But that's what nitroglycerin does, right? It reduces pain with lack of blood flow to the heart. And then the people who are doing the study are like, back to the drawing board. And they're like, send us the drugs back. And like, they weren't getting them back. Like, what is happening? Patients never keep these drugs. And so, of course, the patients noted that their penis was working better on these drugs. And that's how Viagra was born. It was initially a heart drug for angina, but then we developed into a penis drug. And Cialis had a similar history. And so it's not that surprising as we look back at the data, which has been in front of us now for 20 to 25 years, that men who take these drugs consistently seem to have a much lower risk of heart disease. The mechanism is unclear. It probably has to do with endothelial health, the inner lining of the blood vessels being healthy, has to do with maybe decreasing clotting in the major blood vessels. You get drugs like Viagra and Cialis, sildenafil, tadalafil, or the names. And if you take them, not only do they help erections, we also discovered that tadalafil, which is a drug that stays in your bloodstream for 24 hours, used to be called the weekender. It actually helps with urinary symptoms as well. And then now
helps how?
It helps with these urgency, frequency, getting up in the middle of the night type symptoms. So tadalafil has an FDA indication for urinary symptoms or LUTs, lower urinary tract symptoms. And so I write for these drugs a lot because I find every excuse I can to give them to men, whether they have problems with erections, whether they have problems with urination, and then they get this likely benefit of cardiac protection.